Hi, and welcome to this ABC Vascular Ultrasound case study, ascending thrombophlebitis of the great saphenous vein with partial deep vein thrombosis of the common femoral vein. This is a case of a 30-year-old female patient that attended accident emergency for ongoing pain, tenderness, and redness of the thigh and calf. An ultrasound investigation was therefore requested. The first step is to perform intermittent compression ultrasound manoeuvre at the level of the groin, where the common femoral vein is visible alongside with the saphenofemoral junction. The intermittent compression demonstrates a partial compression of the common femoral vein. The intermittent compression ultrasound manoeuvre is therefore performed throughout the course of the great saphenous vein. The great saphenous vein is not compressible when applying gentle pressure over the transducer. This is due to the presence of an obstructive thrombus, which is visible on the B-mode imaging. We then can move the transducer back into the saphenofemoral junction to better assess the borders and extension of the thrombus. The thrombus is hyperechoic, well attached to the wall of the great saphenous vein, with extension into the saphenofemoral junction and proximal region of the common femoral vein. As the thrombus within the common femoral vein was limited to the region adjacent to the saphenofemoral junction, it was considered as an extension of the great saphenous vein thrombosis. The distal region of the common femoral vein was patent and compressible. The patient was therefore diagnosed with a chronic ascending thrombophlebitis of the great saphenous vein with extension into the deep venous system, causing partial obstructive deep vein thrombosis. Thanks for watching ABC Vascular Ultrasound.